La, la, la. Alrighty, so moving on. So part 3, anatomy and physiology. The next system we're going to cover is the respiratory system, and like I said, I really stress this particular system because it's one of the systems that students really struggle with. So I get really in depth. In a way, you can say I get carried away with it. But with the respiratory system, what are the functions of the respiratory system?
Helps you breathe.
Supply oxygen to your body.
Well, no, that's the circulatory system. I just love how students pay attention to what I say. And I'm not talking about you guys.
The respiratory system is what helps you breathe, right?
All right. All right. So going back, so function of the respiratory system is number one, you have to get oxygen into the body because that needs to come in and be able to feed the tissues, really the body. Now, what else is it doing? So we inhale to get oxygen, and when we exhale, what are we getting rid of?
The removal of the carbon dioxide.
Yeah.
Dioxide. Yeah.
It eliminates carbon dioxide. What else?
The respiration and ventilation.
Okay. What else? It helps with the buffering of the acid-base balance within the body. And we'll talk more about that when we get to pathophysiology, chapter 8, okay, which will be next week. So it helps get the oxygen in, get rid of the carbon dioxide, helps with acid-base balance. It's a really important system. Without it, we can't get air into the lungs, thereby getting into, as somebody said earlier, into the circulation. In other words, the body needs to deliver that. Just kind of think about Carlos bought something on Amazon that he bought it from Jessica's store. So she's going to ship it. Well, how is Carlos going to get that package? Through UPS, FedEx, from somewhere.
Yeah.
And so that's what the respiratory or the circulatory system does. But right now, the respiratory system, think about being the Amazon warehouse or distribution center. The things come in there and then they get sent off via however they get sent off. Post office, FedEx, UPS, DHL, whatever the case is. So as far as the components of the respiratory system, what are they?
Lungs,
Okay.
throat,
Esophagus?
No, that's not respiratory system.
Trachea?
Okay. So, Brian, you mentioned the throat, but there's other parts of the throat. Part of it is the trachea. You got the larynx. What else?
The pharynx.
The pharynx,
Diaphragm.
the diaphragm,
bronchial tubes,
the what?
bronchial tubes,
The bronchioles, the nose and the mouth.
Nasal
Lungs.
epithelium.
All those structures are important for breathing. Normally, right now I'm talking, so I might get air through my nose or through my mouth when I pause. So air has to go in some way. And there's two ways. Well, most of us at night when we sleep, are we using our mouth to breathe?
yeah.
No. Our nose.
Our nose.
Oh no, the nose, yeah.
Yeah. It's through the nose. So the airway or the respiratory system is divided into two types of airways. We have the upper airway and we have the lower airway. The upper airway is above the larynx, or the larynx and above. Whereas the lower airway, you're talking about the trachea, the bronchioles, the lungs, alveoli. Now, as far as the lungs go, inside the lungs, there's little microscopic air sacs. And those air sacs are called alveoli. So as the oxygen goes in through our either nose or mouth, it goes down either in the back. The pharynx is the back end of the nose and the mouth. And it goes down into the larynx. It goes through the epiglottis. Epiglottis. a leaf-like structure that covers the trachea when we're eating or drinking, but it opens up to allow oxygen and carbon dioxide to go through it into the trachea or out of the trachea, whatever it is, oxygen or carbon dioxide. So goes down the trachea. We get to a point where the trachea divides. That division where you got the trachea, and again, I wish I could draw it. I can kind of draw it here. Not going to be very good, so I'm sorry. So you have the trachea that goes down, and then you have the right and the left bronchus. This point right here, let me change color. And again, I hate doing this with a mouse because they're not very good, but I hate this. Right in there. That's called the carina. C-A-R-I-N-A. I don't know why they make it a big deal that you know that, but you got to know that. And so,
What was that?
right,
Carina?
what was that?
What was that again? The way you said the carina?
Yeah, carina. C-A-R-I-N-A.
Okay.
All right, so you get into the bronchioles. The bronchioles are branches off the bronchi. That's plural. Like I said, the bronchioles are the branches, and then at the end, the leaves are the alveoli. So think about the trachea as the tree trunk. This is an inverted tree. So the trachea is the tree trunk, and then the limbs that come off the trunk, those are the bronchioles. I'm sorry, I take that back. Those are the bronchi. And then the branches off those limbs are the bronchioles, and at the end you have the leaves, which are the alveoli. Okay. Now the other component here is the diaphragm. The diaphragm is a dome-shaped muscle, and because it's a muscle, is it going to contract like other muscles do? Yes or no? It's going to contract like other muscles do?
No.
Yes. It's a muscle. Okay, so there's the upper and lower. Now, those bronchioles, the branches, they are smooth muscle. So they contract, get smaller, they constrict, actually, they constrict, get smaller, or they dilate, they get bigger. So when do you think your bronchioles would dilate, get bigger?
You breathe out.
What was that?
Out.
I can't hear you. You're muffled.
I said when you breathe out.
Nope.
Breathe in, I guess.
Kind of, sort of, but it can happen both breathing in and breathing out. But there's a particular time when the bronchioles and blood vessels do the same thing. They constrict and dilate. But right now we're talking about the respiratory system. So the bronchioles, it's smooth muscle, and they constrict and dilate.
I'd say if you're working out.
No. Kind of, but not really. Would you be afraid of a lion charging you and wants to make you a meal?
Yeah.
Yeah, probably.
Yeah, right? So with that, you're going to want to run. You feel brave enough to fight it?
No.
So let's say Lisbeth wants to fight that damn lion. She ain't afraid of no lions and ghosts. Okay? Elizabeth's like, what? Huh? Where's your camera, young lady?
Could be.
Uh-huh. Oh, I picked names at random. I believe I picked names at random. All right, so Lisbeth, you're gonna fight that lion, right?
Yes. I know.
Fighting. Hell yeah, bring it on, right? Are you going to need energy in order to fight that damn lion?
Am I gonna need a what?
Energy.
Energy?
Uh-huh.
Yes.
Yeah, right?
Yeah.
Well, another preview to chapter 8, you need oxygen to help create that energy. So do you think the normal amount of oxygen you're getting right now is going to be sufficient to meet those needs?
To fight a lion?
Correct.
I don't.
And no guns, just your bare hands. Okay, I'll give you a knife. I'll give you the Crocodile Dundee knife. How's that?
Um.
Or better yet, you're Wolverine. You're the female Wolverine, so you got those claws. Still, you're gonna need the energy.
Yes, I'm gonna need the energy.
All right. So, and because we need oxygen for that energy, do you think you might need a little bit more oxygen than normal than what you're getting right now?
Yes.
Yes, right? So guess what's going to happen? What's going to happen to your bronchioles right now if you need to get more oxygen into your body? Did you see my screen?
Yes, I'm seeing it.
Do you see the picture on the right?
Yes.
What does it say on top of that vessel?
Vasodilation.
Vasodilation.
Oh.
In other words, it's going to go, it's going to get bigger, right? Because don't you want to get more oxygen into your body for that energy?
Yes.
Yeah. So you guys are seeing what happens? If you need to get more oxygen, your blood or your bronchioles need to get bigger to allow more air to go in to be able to burn up more energy or create more energy. All right. So Lisbeth killed that damn lion. Yay, Lisbeth. High five. Or she made it into a house pet. All right. So that's where vasodilation, or in this case, bronchodilation, is going to occur to allow more oxygen to get into the lungs. Okay, you guys follow?
Yeah.
All right. Now, the lungs themselves have sacs. Remember earlier we talked about the collapse of the lung? Now, do the lungs move?
Yes.
Yes.
Yes, they do.
Yes.
Yes.
When we inhale, they get bigger. When we exhale, they get smaller. Well, what happens is here's a sac called the pleural sac, and then you have two pleuras. You see the picture up there, parietal pleura and the visceral pleura. The visceral pleura is right over the lung, whereas the parietal pleura is inside the chest cavity. It lines it. Anyway, so here's the visceral pleura, the one that covers the lung. And here's the lung. So the lung is going to expand and get smaller, bigger, smaller, bigger, smaller. Okay. And so if something happens to that visceral pleura, that pleural sac, then, like for example, there's a puncture. Earlier when Jessica stabbed her significant other for complaining about her cooking, it allowed air to go in there. And so it's building up within that pleural sac and it collapses the lung. So it's a protective mechanism to allow for the movement of the lung to help it keep its shape. All right, that makes sense?
Yeah.
All right. So here we see the normal and the constricted bronchial. Now, there could be a disease process like an allergic reaction that's causing that bronchial to constrict, to get smaller. And then you throw in asthma, and what's going to happen is you're going to have mucus building up within that bronchial. So somebody mentioned wheezing earlier. Well, that's what wheezing is. If you think about it, and to give you an example, go ahead and purse your lips. In other words, like you're going to kiss somebody, right? And now push air through that. Right? That's what a wheeze is. Because you're pushing air through a smaller aperture opening. And so you get that wheezing sound. Okay? Because of the bronchial constriction. You guys follow? So the smooth muscle around the bronchioles will constrict, making that tube smaller. And they relax to make that tube bigger. All right. Questions on that part?
No.
All right. Ding dong. Now, as far as differences in anatomy between kids and adults, obviously they're smaller, right? Kids are smaller. So what we want to do, or actually not what we want to do. So the trachea is going to be smaller, right? One thing that's bigger is the tongue. When you put in relationship to an adult, the tongue is going to be bigger inside a kid than in an adult. So it takes up more room. The other thing is the way the trachea is. When you suction up fluid through a straw, does that straw collapse? No, right? It's rigid. If that straw was rigid, what would happen as you try to suck up that fluid?
Would it come up?
it would collapse.
Yeah.
If it's flimsy, it's going to collapse. So that's why straws are rigid. Unless you go to California and then they give you paper straws. Stupid. But anyway.
Hey, straws are outlawed in California.
Yes, I know. I was just there 2 weeks ago or a week and a half ago. Remember that Friday or that Thursday I took off? That McKeelan covered for me?
Oh yeah.
So anyway, so the trachea has rings around it and they're cartilage. So just like your nose is cartilage, just like your ears is cartilage, the trachea also has cartilage. And that's what allows the trachea to be firm because of that cricoid cartilage. Now with kids, that cartilage is less rigid, so it collapses easily. Where an adult, firmer, doesn't collapse as easily. Okay. Nose is going to be smaller. Oh, hi. Nose is going to be smaller. All right. So, any questions there?
No.
All right. So, I'm just curious, is anyone taking notes?
Yes.
Yes.
So, the mechanics of ventilation. Ventilation is a process of moving air into the body. The way it does it, and I mentioned it at the beginning, during inhalation or breathing in, remember that dome-shaped muscle? Hold on a second.
Right.
No worries.
Can you?
I can hear you.
All right, sorry guys. So as far as, like I said, inhalation, what was that dome-shaped muscle? Remember the diaphragm? So the diaphragm is going to contract. It's gonna, in other words, it's gonna drop. It's gonna drop. The other thing that's gonna happen is there's muscles in between the ribs. We call those intercostal muscles. And those intercostal muscles are also going to contract. So what do you think those muscles are going to cause the rib cage to do because they're contracting?
They're gonna tighten or expand.
It's going to expand the chest. And the diaphragm drop to allow for air or for the lungs to get bigger. But it's also creating a negative pressure. So it's bringing air in to the chest cavity. because I mentioned Boyle's law, and we'll talk more about that on chapter 8 next week. By allowing by creating that negative pressure, our pressure outside here is positive. About 765 torque. Inside the chest, it's less. And so gases, they tend to go into areas of lower concentration or lower pressures. It wants to try and equalize. And so that's why the higher pressure outside of us goes inside our lungs to equalize. And so that brings the air. 21% of that air around us has oxygen or is oxygen. So we need that 21%. Okay. Now, we get to the point where we got all that oxygen. There's stretch receptors that prevent the lungs from overfilling. And then there's a reflex, and I'm not going to hold you to this. I'm just telling you what it is. There's a reflex called the Herring-Brewer reflex. Herring, like the red herring, the fish, or maybe it's a bird. No, it's a bird, I think. Herring, herring. And then brewer, B-R-E-U-R. The Herring-Brewer reflex, that as soon as we hit maximum inspiration, we start to exhale. And so the intercostal muscles do what now? Or actually, let me rephrase that. The intercostal muscles and the diaphragm do what now?
Relax.
Exactly. Now they relax. Now we have all that air in there. So where's the pressure greater? Inside or outside?
Inside?
Inside. And what did we say about gases and pressures? That they want to equalize, right? So that they go to areas of lower pressures, right? So we get that air, that carbon dioxide now, we get it out into the environment. We breathe it out because that air is coming out now, trying to equalize. And we do that about 12 to 20 times a minute. Contraction, relaxation. Negative pressure, positive pressure. Negative, positive, negative, positive, negative, positive. Okay? You see how that works?
Yeah.
All right. Any questions on the mechanics? So earlier when Seth got hit, did I affect his mechanics of respiration? Yeah, because the muscles were sore and he wasn't able to fully expand his chest. Ooh. All right. Now, the physiology of respiration. We said how the oxygen goes in, right? And so once it goes down the trachea, where does it go?
To the bronchioles.
Before the bronchioles.
Lungs.
Lungs.
Before the lungs. Trachea, and then
The one you told us to remember.
it's going to pass the carina. And then from the carina, we get what? The two limbs, remember?
The alveolus?
Nope. The alveoli are the leaves.
I can't. I don't remember this one.
Oh, yeah, I thought those were
The bronchi or the bronchus. Bronchus is one, bronchi is two. The right and the left main stem bronchus. All right, from the bronchi, it goes where, Brian?
What was that?
From the bronchus, it goes to what structure?
What is the name of it? The bronchus to bronchi tree. What is it? Bronchus tree? Can't remember.
Bronchioles.
The bronchioles. You said bronchioles earlier.
Yeah, no.
Is that you, Brendan? Okay. So the bronchioles, the branches. And then from the bronchioles, it goes to what?
Alveoli.
Alveoli. To the alveoli. All right. So here's an alveoli. Here's my sac. And around each alveoli, there's a capillary bed. Blood. Blood is coming in to pick up its oxygen and dump off its carbon dioxide. That process is called diffusion. In other words, let's say we were in class and Jose decides to cut the cheese. So his neighbors right around him right away are gonna be like, damn, somebody is eating some cheese, right? So it's really concentrated there. But eventually, the people in the back row are gonna be like, oh, damn, somebody's cutting some cheese, right? Diffusion is gases going from an area of higher concentration to lower concentration. We're not talking about equalization of pressure. We're talking about in diffusion, how gases go from an area of higher concentration to lower concentration. Same thing when you spray a room with Lysol or with Glade or whatever, Febreze. Right around you, when you first spray it, it smells pretty strong, right?
Yeah.
But eventually it starts to circulate and you start smelling it in other areas, correct?
Yeah.
So that process, speaking of Lysol, I'm just doing a little disinfecting here. So the pressure, or I'm sorry, not pressure, the gas concentration is going to try to equalize as well. Higher concentration, lower concentration. So right now in the alveoli, we just breathed in oxygen, right? So where's the oxygen concentration greater? Is it inside the alveoli or in the bloodstream?
In the bloodstream.
We just breathed in.
Bronchula.
Oh, okay.
It's in the alveoli.
Alveoli.
And it's less in the capillaries, right? In the bloodstream. So because of diffusion, what's going to happen?
Make it even less.
Not make it less.
Well, it's filtering out the carbon dioxide to exhale it out, right?
Hold on a second.
Don't be eating those chips. You're idiot. You over now.
All right. So again, the oxygen in the alveoli is greater than in the bloodstream. So diffusion says that that greater concentration is going to go into the lower concentration, which means it's going to get into the bloodstream, right? All right. So now let's talk about the carbon dioxide. Where's the concentration of carbon dioxide greater? In the bloodstream or in the alveoli?
Velia? Velia? I can't even talk today.
No, not the alveoli.
So the bloodstream.
In the bloodstream. So what's going to happen to that carbon dioxide?
You want to exhale?
Well, before we exhale it, it needs to diffuse through, right?
Yeah.
So again, definition, and let me put it on the chat. Let me put it on the chat. All right. So diffusion. Process of gas going from an area of higher concentration, area of lower concentration. Why is it saying L or T's? All right, there's your definition. Diffusion, the process of a gas going from an area of higher concentration to an area of lower concentration. Does that help? So again, carbon dioxide, the concentration is greater in the bloodstream than in the alveoli. So it's going to diffuse through into the alveoli. And then, as Brian said, we exhale, we're breathing out a lot of carbon dioxide. That's one way the body controls the acid-base balance. We exhale excess carbon dioxide. Because carbon dioxide, wakala. Mikey no like it. Mikey no like it. That's why I have cousins and some nieces and nephews that call me Mikey. Or Uncle Mikey. But I have two of them that call me Uncle Monkey. Because they couldn't say Mikey very well, so they'd say Monkey. Actually, one of them started calling me that. The other one heard it, so I'm their Uncle Monkey. So see, this is exactly what's happening. You have the bronchial and then the alveoli. The oxygen goes into the bloodstream because there's less oxygen in the bloodstream than in the alveoli, and then vice versa. The carbon dioxide is greater in the bloodstream than in the alveoli, so it diffuses through into the alveoli. And so, okay, there's gas exchange. Any questions up to this point? Anything you guys want me to repeat? You sure? Positive.
I have a question. So the coronae is in between the two bronchi.
Yeah, as the trachea goes down, then it bifurcates. Technical word for it divides into two. And so the junction, it's a triangular junction where as the bronchioles or the bronchi begin to divide, that junction is called the carina.
Oh, okay.
And I have a feeling you're going to see a question that maybe, I don't know, you'll see it somewhere soon. I can't say it's going to be tomorrow, and I can't say that it's going to be next week. But between now and next week, you're going to see it. How's that?
Okay.
By the end of next week. What's your next test? Next week?
25th,
next week.
Tuesday.
So it's
On
the
Tuesday,
tracheal, then it's the bronchi, and then you have the bronchioles after that,
Yes.
and then the alveoli.
Alveoli.
Alveoli. Okay.
Alveoli. On the chat. Oh, all right. Any other questions? Please ask. See this is what happens because I talk a lot. I just ramble. I go on, and don't be afraid to tell me, Lou, slow the fuck down.
Get on with it, man.
Well, I could. All right. So with National Registry, oh look, I forgot. As far as National Registry goes, you'll have questions, obviously. When it comes to vital signs, and respirations are vital signs. They're not going to get too complex with vital signs. What's going to happen is, well, let me back up a bit. Sorry. Is your blood pressure constantly changing?
Yes.
Yeah. You deal with your wife, you deal with your parents, you deal with your kids, you get in your car, you go to work, your blood pressure goes up, doesn't it? Yeah. It's constantly changing. Hold on a sec. All right. So anyway, so your blood pressure is constantly changing, and so it's hard to say, okay, is that normal or abnormal? Because like I said, there's a lot of things that happen that's going to cause your blood pressure to go up. So usually you're not going to be asked a specific blood pressure question. Where you see it is they might tell you, okay, your patient is going through this. This is their vitals. Blood pressure is this. Should be able to recognize a low blood pressure on an adult. Okay, and you should be able to recognize a high blood pressure on an adult. But it's not going to be more of a, is this normal or abnormal? Pulse rate, same thing. It's constantly changing. Know what rapid heart rate is. Know what a slow heart rate is. But it's usually in conjunction with the scenario. They'll tell you this is the vitals. So what's the patient suffering from? They'll give you an idea. The one they are going to test you on is respiratory. They'll throw in a question and then they'll have the respiratory rate. You need to know whether it's normal or abnormal. Okay. Now, make sure you write these down or make sure you commit them to memory. They are different from what's in the book, what you're reading. So in order for breathing to be adequate, we have to take enough of a breath, which is about 500 cc's of air, or 500 milliliters, which is about the equivalent of a water bottle. Okay. And then also we want to have good rise and fall of the chest expanding and collapsing. We want good rise and fall of the chest. And also we want to look at the rate. The breathing rate or respiratory rate for an adult is 12 to 20 times a minute. Okay, 12 to 20 times a minute. Got that? So what's the respiratory rate for an adult?
12 to 20 a minute.
12 to 20. Children.
20 to 22.
For children, the normal respiratory rate for a child is 15 to 30. And the way to remember that is you start off at 15 and you double it up and you get
30.
30. Just remember it that way. 15 to 30. 15 times 2 equals 30. Okay? So I know what I said in there. Or what I said about these numbers. You just want to think about normal. They're between 15 and 30, they're doing okay. Now, an infant is those kids that are under 1 year of age. So an infant, don't look at that number, that 30 to 60 is for newborns. For an infant, it's 25 to 50. And how can you remember that?
Double it.
25 and you double it up and you get 50. All right. Questions on those?
No.
All right. Now, other things for adequate breathing. And a lot of you are muted, so we can't really hear it. But think about the area. If you have people around you, or just think about being in class. If you listen in, do you hear anybody breathing? Do you really see anybody breathing?
Not really. I mean,
you might see the chest go up and down.
but it's not a noticeable action that you can see.
Yeah. Normal breathing is effortless. We don't have to really work at breathing. Again, They're not leaning forward. They're not, right? You don't hear anything abnormal. You don't see them working. You don't hear anything, no abnormal noises. It's effortless. I already said that. That's normal breathing. And remember what I said earlier at the beginning of this. You can't know what abnormal is till you know what normal is. So understanding, knowing what normal breathing entails, when you don't have that, then you know it's abnormal breathing. So again, what are the signs of normal breathing?
Nose flare, if you notice it. Chest.
Normal breathing. Normal breathing.
Effortless.
It's effortless.
Chest rising.
Normal chest rise and fall of the chest.
Usually quiet. I
Yeah,
mean,
no sounds, no wheezing or any sounds of any sort.
Okay. What else?
They're not gasping for air.
Not gasping for air. Now, if you look at the last bullet point, it talks about no accessory muscles. Earlier with Seth, when he was hurting, he couldn't fully expand his chest, right?
No.
And so what these accessory muscles are, they're usually not used. But because he needs to get air, these muscles are going to come into play, and they're going to help the chest expand to be able to get more air in. So on a normal adult, we should not be seeing accessory muscles. And the accessory muscles tend to be the upper intercostals and then the abdominal muscles. So if you see them breathing with their abdomen, that's not a good sign. Kids, not a problem. They have a smaller thorax, so abdominal breathing is okay. But with adults, it's not. I remember when my dad was in the hospital, I told the nurse, hey, he's breathing with his abdomen. He has abdominal breathing. And they're like, no, he doesn't. Yeah, he does. Look. And she looks and observes, and she's like, oh, you're right. He does have it. Okay, well, let's get respiratory in here. Like, I'm not dumb. Well, I am dumb, but not that dumb. Just kidding. Smile, chuckle. Let me know you guys are awake. Paying attention. So, but no, you should not see the abdominal muscles working to breathe. So with inadequate, as Brandon started saying, you have nasal flaring. Again, we don't need to work to breathe, but if the nostrils are flaring, what does that mean?
Struggling.
It's what? I'm sorry?
He's struggling.
Struggling to breathe, not getting enough oxygen. So why are the nostrils going to get bigger?
Just opening
Try to
up the
take in more air.
Open it up to get more air. They're bigger, more air comes in, more intake. Okay. Maybe there's something that's causing an irregular rhythm of the breathing. If you listen to lung sounds, you don't hear a lot of air coming in, or even no air coming in. If it's bad enough, they will turn blue like a Smurf. And I've seen it. It's weird. And then you guys took CPR. What's agonal breathing?
Struggling, like That's it.
Painful breathing?
No, not necessarily painful breathing.
Was it like gasping?
Yeah, it's the gasping respirations. Another way to think about it is the patient is sputtering out. Remember the CPR video where they had the dude there and all of a sudden he just goes,
Yeah.
yeah, they're just gasps. Kind of a last ditch effort to breathe. All right, so I'm trying to remember. Kevin was Brandon. Brandon's assessment of the patient's breathing reveals respirations of 30 times a minute that are shallow. So is that normal or abnormal?
Abnormal.
Shallow, abnormal.
It's abnormal.
Normal.
Because it's shallow and the 30 respirations a minute that goes above the 20. So breath sounds on the left side of the chest are diminished in comparison to those of the right side. So abnormal lung sounds?
Yes.
Yes. So is this guy messed up?
Yes.
Yeah, he is. So again, he shouldn't have complained about Jessica's cooking. So are the patient's ventilations adequate or inadequate? And why?
Ventilations. This is going off the same scenario.
Yes.
Okay. I would say inadequate because it's short and shallow breathing. You
Why
got
else?
abnormal sounds.
Okay, but why else are they inadequate besides the
The
signs that we're seeing?
That,
The rate's too high.
Okay. And he got stabbed in the chest?
also,
Mhm.
So how are the patient's injuries? Think about this. I covered it. How are the patient's injuries affecting his body at a cellular level? What was that? Oh. No, you're good, Brendan.
Diffusion isn't able to take place in one of his lungs?
Okay, that's part of it, but what else?
fusion and diffusion, not able to inhale.
Well, we have issues with the inhalation, right? We're not getting enough oxygen. But we want to know about the cellular level.
Bronchial tubes are damaged.
Maybe, maybe not. No.
We
You
don't-
gotta think deeper inside the body, down in the cells in your knee or your kidneys or wherever.
You're not getting oxygen through your bloodstream.
Okay, there's reduced blood flow or oxygen in the bloodstream.
And it's
So-
not able to exhale the carbon dioxide out of the bloodstream.
Well, no, that's not exhalation. When it's talking about carbon dioxide in the bloodstream, that's not exhalation.
Okay.
But yeah, that's gonna be one thing. But think about it. If you're not able to get enough oxygen, then how much oxygen are you delivering to the cells in the brain and the heart and the kidneys and the liver and the skin and the big toe and the
Not enough.
I think not enough.
yeah. I heard that female voice first say not enough, so I'll give you credit because I did hear you. Although I didn't see who it was.
It was me.
Oh, Jessica?
Yes.
Well, good job, Jessica.
Thank you.
So yeah, we're gonna have low oxygen level at the cells. And so really what's gonna happen is those cells are not gonna get enough oxygen. and they're gonna get hissy. Worse than forgetting your wife's or girlfriend's birthday. So, man, I just forgot a birthday, and man, am I in trouble. So the body is gonna let you know. Okay. All right. Any questions on the respiratory system? Structures, diffusion, negative pressure. All right then. So make sure you review your notes. You'll have a quiz tomorrow just on what we covered up to this point. Okay, it's not going to include cardiovascular or nervous or anything else. It's just going to cover respiratory, musculoskeletal terms, positions. Okay. So you guys have nothing for me.
Nope.
All right. So at 17 minutes to 12, usually this is where I stop. So we'll stop here. I don't want to start cardiovascular. We'll get into that tomorrow. Tomorrow. Review, take notes, do flashcards. Start getting used to this stuff. Okay. Go ahead, read ahead. Should be reading ahead. So that way when we talk about it, you guys can give me an answer. All right?
All right.
Did you guys have fun today?
Yeah.
I learned a lot.
Are you guys kind of getting used to being at home and doing this class?
Yeah.
No.
Not really.
I know for some people, the kids kind of come in or they want attention because you're there or whatever the case is. It can be a little bit distracting. But what I'm going to do is, like I said, I'm going to create your guys' section of my YouTube channel. And I'll post the videos. Okay. So that way you guys can review. It does take me a little bit to get those videos up because I have to download them and then I have to upload them to YouTube. Alrighty?
Okay.
All right, guys. If you guys have nothing else, I will see you guys tomorrow. Have a wonderful rest of your day and be safe.
You
Thank you. You too.
All right. Bye, everybody.